All disease begins in the gut. Your hormones influenced by your gut. Your energy levels influenced by your gut. Your metabolism is influenced by your gut. In today's video, I want to be talking about different types of gut conditions and issues such as SIBO, small intestinal bacterial overgrowth, H. pylori, also known as really indigestion, and then leaky gut, also known as intestinal permeability. And I'm going to tell you the exact things that you should be doing if you are struggling with these things, and what the actual research is saying, and what you can do to honestly help you with your chronic health issues. Because when we look at these three specific conditions, there are three primary symptoms that you will feel. One with SIBO is obviously extreme bloating, abdominal pain, and constipation. H. pylori is indigestion, acid reflux, heartburn, gastritis symptoms all occur, and leaky gut, inflammation, neuroinflammation, brain fog, fatigue, insomnia. So I don't have too many notes for this video. I just kind of have these laid out. So just going off of like what we already know, and then what I do know, and going off like working with individuals on a day-to-day basis in my coaching program. Many of the times I have an individual come in and they're struggling with constipation, bloating, abdominal pain, diarrhea. It's going back and forth, and for majority of the time they also have the IBS label, and irritable bowel syndrome, and you may have this label as well. And what's happening is that they're not getting a deeper look. In the majority of the time, it's actually SIBO, small intestinal bacterial overgrowth. Now this is when there's an overgrowth of bacteria in the small intestine, exactly how it sounds. Which happens then is that it can methane, and then you can get these extreme symptoms of the abdominal pain, the bloating, and all that. So how can you actually solve your SIBO? Well, it actually starts out with starving and getting rid of the negative bacteria that's inside, that's fermented within your gut, in the small intestine. So how you can do this is that there is antimicrobial supplementation, and in literature, in research, antimicrobial treatment has been more effective than some antibiotics. Also, you can follow a lower FODMAP diet that quote starves the bad bacteria, the bacteria within the small intestine. So if you are dealing with SIBO, so you suspect SIBO or anything like that, that would be my first step, is to stick to low FODMAP and perhaps using antimicrobial supplementation. Now there's actually really good literature out there that shows that probiotic supplementation is very helpful in SIBO and these fungal overgrowth issues like candida or like H. pylori, for example, because most people think that if you do take a probiotic, it actually will cause you more symptoms, but it has been shown that probiotics don't actually colonize in the gut. My apologies. They don't actually colonize in the gut. So there's clear literature that shows that probiotics have antibacterial, antifungal, benefits for specific issues, as well as lowering inflammation and repairing leaky gut. So probiotics actually have some very good, literature behind them. Now it all depends on what type of probiotic you're using. In some of the research, they're using multi-strain like lactobacillus, acidophilus, bifidobacteria, and different other types, and they're using around like 10 billion to 100 billion IUs, which is the strain number. Now, so I told you probiotics, antifungals, antibacterials, and the low FODMAP diet are all going to dramatically help you with honestly any like gut issue, but SIBO in particular, because we are working on getting rid of the bacteria, the negative bacteria within the small intestine, lowering the inflammation, and then so quote starving the bacteria within the small intestine by following lower FODMAP. And then the thing is that this is where many get wrong, and this is where many people don't understand, and physicians maybe get it wrong sometimes, is that they don't support other organ systems and other glands that also influence your gastrointestinal tract. So what I mean by that is that if you don't have support for your thyroid, because thyroid supports gut motility and also something known as your migrating motor complex, that essentially will also influence your gut, your gut health. Also your adrenals. If you are in some type of adrenal dysfunction, whether it be adrenal fatigue, adrenal insufficiency, or whatever, that impairs gut function. Okay, so all these things matter. Also liver, if you have toxin overload, you have mold, all these things will impact your ability to heal your gut. So this is why inside the program that I run, we run a very comprehensive, all-in-one, exclusive protocol, so to say, that works on everything. I'm talking about nutrition, training, supplements, lifestyle, but the way that we use it is more of a functional approach, meaning we're looking at all the organ systems, we're looking at all the hormones that influence the gut. So, going back to what I'm saying, if you are doing a gut protocol, you want to be supporting other glands and hormones as well. And so what I say and I suggest is that majority of the time, many people that struggle with gut issues also have stress issues, like high cortisol perhaps. And so I like to use adaptogenic herbs or things that are helping with lowering the stress response within inside the body, because that definitely will help you with your gut issues. Another one is also supporting your thyroid. Like I said, 1 in 8 women and about 60% of the population don't even know they have a thyroid issue to begin with. So, and definitely using something to support the thyroid will help no matter what. But also using something to support the thyroid, using something to support the thyroid while you're healing your gut has been shown to be just dramatically, improving the outcomes for whatever you're struggling with. And so SIBO's, it's very, underrated. I mean, it's getting more and more talked about, but more people aren't realizing that, their IBS label is actually SIBO. And, it's sad because, some of the testing of it can be flawed. Like there's a lot of SIBO breath tests, which are good, but sometimes, they can be misleading because in clinical settings, we're talking about meta-analysis studies, meaning groups of populations, gathered up data, clinical outcomes. There is kind of a misnomer with the SIBO breath test. So, personally for me, I like to use a stool test, which is something called a GI map. This is a test that measures the bacteria within inside your gut, and it actually shows overgrowth, dysbiosis, bacteria. So that's always nice that I like to use. It's not an actual indicator of SIBO, but it is something. So back to what I'm saying. So SIBO, probiotic supplementation. I will link a probiotic down below. Probiotic supplementation, low FODMAP diet, obviously stress, lifestyle, get that under control, support other glands and hormones around it, liver, adrenal, thyroid, insulin perhaps. They all play interconnected, looking at a functional approach. Next is H. pylori. H. pylori is, a bacterial overgrowth, in the, kind of in the stomach, in the esophagus area, you could say, meaning just more so when there's an overgrowth within, you don't have enough stomach acid, essentially. So I really put H. pylori, but it's also known as, I say, indigestion, because majority of indigestion cases are H. pylori. So I just want to talk about H. pylori, but you might know it as acid reflux. So what happens is that when we continue to stress and we continue to eat food that damages the gut lining, going to leaky gut next, and we cause a lot of inflammation within inside our gut, it slows our digestive secretion. So what does that mean for you? That means we usually have not enough stomach acid to help with the digestion process of food. So what then happens is that we don't have enough to actually eliminate the bacteria that we have in our food, okay? And then our bacteria just sits there and it gets sterile, and then there becomes an overgrowth. And then when you get that, like for real, like when you get that, like that burping, bleaching, all that, that is from the indigestion from the low stomach acid. Now the bacteria buildup can cause H. pylori. So many people take digestive enzymes and they don't feel better, and it's because they're dealing with H. pylori. So that's why I want to talk about it. So how can we actually improve H. pylori, indigestion, acid reflux? Well, if you suspect that it's just low stomach acid, then you can perhaps supplement with hydrochloric acid and then different types of pancreatic enzymes or bile or pepsin and things like that. But if you do suspect H. pylori, you're going to want to eradicate it with antimicrobial and or antifungal supplementation. So what does that mean? So there's things like oil of oregano is a really good herb that can help with eradicating H. pylori. There are other supplements that I use inside my coaching that I use to help with eradicating H. pylori. But then going back to what I said before with the SIBO, you're going to be wanting to follow, a lower FODMAP diet. Obviously eliminating, begin with too, like the common allergens as well, like gluten, dairy, soy, processed food, artificial sweeteners, all these things. You're going to want to eliminate that, and then obviously get your stress under control. But I see a lot of people with H. pylori that don't even know it, and it's unfortunate because sadly it's true. If you continue to have these indigestion, acid reflux problems, you can develop esophageal cancer, and that holds dear to me because I lost my grandfather from that. So I think it's very important, and as I touched on the topic, you should be, also feeling it, because H. pylori is so underrated inside our, society. They kind of just think that if they throw digestive enzymes into their acid reflux symptoms that they're going to feel better. But like I said, majority of the time it's actually, H. pylori. And so most people actually, diss like PPIs, proton pump inhibitors, which they do not cause anything good. But there is evidence that shows that if you have ulcers, that it actually can help if it's done for a 4 to 6 week period to help heal the intestinal lining, actually. But that's topic for another time, because I'm trying to start anything here. So H. pylori, definitely. So how to actually solve it? My apologies. I got like 5 hours of sleep. We're good. Work life, Okay. So H. pylori. So how are we going to solve it? So number one is to obviously eliminate the food allergens: gluten, wheat, soy, corn, dairy. And the next thing is to follow a lower FODMAP diet, because that's still bacteria and fungal overgrowth, and you still want to stick to that low FODMAP diet like you did with SIBO. Okay, and then you perhaps can use digestive enzymes, mainly hydrochloric acid, HCl. And that would vary. And I could link my favorite. I have this one that I use with all my clients called Utilize, and they love it. I love it. It comes in little bags. Okay, but remember this also, next step, support other organ systems around it, such as your adrenal glands, your thyroid, even your liver as well, because if we can work on detoxification out of toxins from the liver, that inevitably will help with the H. pylori. Okay. And so, and then next one is leaky gut. So, quick and dirty on the leaky gut is that you have your intestinal walls, which are like this. I'll do it like this, it'd be better. So you have your intestinal walls like this, and then you have junctions. You have junctions that tighten them together. Okay, see, and then there's there's these two walls called your mucosa layer, that's what it's called. And then you have epithelial cells inside there that tighten the junctions. And what happens is that when they become when they split from inflammation, terrible processed food, different rounds of antibiotics, they destroy the intestinal walls. And now what happens is it becomes permeable, aka leaky. And what happens now is that toxins release, something called LPS releases, which is lipopolysaccharides. And this is an inflammatory response that then triggers the immune system. So, above all these gut issues, a lot of autoimmune conditions, Hashimoto's, celiac, Crohn's, obviously, Graves, all can contribute and come from poor gut health, either intestinal permeability, bacterial overgrowth, or anything like that. So how can we actually treat leaky gut? Back to what I was saying, H. pylori too, you can use probiotic supplementation. Leaky gut, you can use probiotic supplementation. And so also anti-inflammatory diet, obviously, to help with lowering the inflammation within the GI tract. The probiotics will also do that, but also using specific supplementation like L-glutamine, zinc carnosine, marshmallow root. Okay, these are like my top ones. Immune colostrum, I really enjoy that. I have this one called Mucosa Repair that I'm gonna link all these supplements below, each one, and so you can get a better understanding. But I like to use that to help with preparing junctions. Now the biggest thing is the lifestyle. So eating a low inflammatory diet, not overstressing yourself through exercise or severely under eating or emotional stress, and then also getting your chemical stress under control. So a lot of times you're dealing with any types of mold, mycotoxins, and yet again, this is why I run a very comprehensive protocol in the beginning, well, throughout the whole program. But when we're just starting, we have to, it's like we come in dysfunction, and just in weeks people feel like a tenfold increase, 100-fold increase. But following anti-inflammatory diet, using supplements like zinc carnosine, L-glutamine, probiotics, lower FODMAP diet, eliminating the food allergens like we said, gluten, wheat, soy, corn, dairy, are all going to dramatically help. So I hope this video helps, and if you need any help, with resetting your gut or getting your energy levels back or losing the stubborn body fat that can come from poor gut health, please let me know. I run a coaching practice. My name is Diego Reyes, functional health coach, functional nutritionist, owner of Complete Vitality Functional Health Coaching. We are here to help you. Our reputation is built on reversing your chronic health condition. Yet again, thank you again. Follow me on all my socials. Check out the other YouTube videos for more in-depth research, studies, and also actionable advice. And hope you all have a blessed day. Thank you.